I'm going to persuade you to stop smoking. Tobacco is a plant grown for its leaves, which are smoked, chewed, or sniffed for a variety of effects. It is considered an additive substance because it contains the chemical nicotine. Tobacco also contains more than 19 known cancer-causing chemicals. Smokers in the United States would like to quit smoking. Most people who have quit smoking made at least one unsuccessful quit attempt in the past. Try not to view past attempts to quit as failures, but rather as learning experience. Here are some of the health risks of smoking or smokeless tobacco. Many smokers come to depend on positive effects of nicotine, such as boosting their mood, improving short-term memory and concentration, and producing a sense of well-being. There are many more reasons to quit using tobacco. Knowing the serious health risks may help motivate you to quit. When used over a long period, tobacco and related chemicals such as tar and nicotine can increase your risk of many health problems. Heart and blood vessel problems. Blood clots and aneurysms in the brain, which can lead to strokes. Blood clots in the leg, which may travel to the lungs. High blood pressure. Poor blood supply to the legs. Cancer. Poor wound healing, especially after surgery. Lung problems such as emphysema and chronic bronchitis or asthma that is harder to control. Other health risks or problems: decreased ability to taste and smell, tooth and gum disease, wrinkling of the skin. Smokers who switch to smokeless tobacco instead of quitting tobacco completely still carry a number of health risks. Increased risk or mouth of nasal cancer, gum problems, tooth wear and cavities, worsening high blood pressure. Health risk of secondhand smoke. Those who are regularly around the smoke of others have a higher risk of heart attacks and heart disease, lung cancer, sudden and severe reactions including those involving the eye, nose, throat, and lower respiratory tract. Infants and children who are regularly exposed to secondhand smoke are at risk of asthma, infections including virus-caused upper respiratory infections, ear infections, and pneumonia. Lung damage, sudden infant death syndrome. Here are some of the benefits of quitting. You will notice many benefits of quitting right away. Your breath, clothes, and hair will smell better. Your sense of smell will return and food will taste better. Your fingers and fingernails will slowly appear less yellow. Your stained teeth will slowly become whiter. Your home, work, and social life will also improve immediately. Your children will be less likely to start smoking themselves. It will be easier and cheaper to find an apartment. You will miss fewer work days, or you might have an easier time getting a job. The constant search for a place to smoke when you're out will be over. Friends will be more willing to come into your car or home. You will have more money available. One pack per day, smokers spend around $1,800 per year on cigarettes. Some health benefits begin almost immediately too, but every week, month, and year without tobacco use only improves your health. Within 20 minutes of quitting, your blood pressure and pulse rate drop to normal, and the temperature of your hands and feet increases to normal. Within 8 hours of quitting, your blood carbon monoxide levels drop and your blood oxygen levels increase, both to normal levels. Within 24 hours of quitting, your risk of sudden heart attack decreases. Within 48 hours, nerve endings begin to regenerate and your sense of smell and taste begin to return normal. Within 2 weeks to 3 months of quitting, your circulation improves and walking becomes easier. Within 1 to 9 months of quitting, your overall energy typically increases and symptoms like coughing, nasal congestion, fatigue, and shortness of breath improve. You will have fewer illnesses, colds, and asthma attacks. You will gradually no longer be short of breath with everyday activities. Within 1 year, your risk of coronary heart disease is half. Within 5 years, your lung cancer death rate decreases by nearly 50%. Within 10 years of quitting, your lung cancer death rate becomes similar to that of